Hi everybody, and welcome to this episode with the Anxious Resistance. And today we're going to be talking about TMS, or Transcranial Magnetic Stimulation. So what is transcranial magnetic stimulation? It's a non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain to improve symptoms of depression. So during a typical TMS session, an electromagnetic coil is placed against your scalp near your forehead, and I'll show you a picture here. The electromagnet painlessly delivers a magnetic pulse that stimulates nerve cells in the region of your brain involved in mood control and depression. It's thought to activate regions of the brain that have decreased activity in depression. So as it targets these regions of the brain that have decreased activity, it helps relieve symptoms by making those regions active again. So some of you may have heard of TMS. Maybe that's why you're here. Maybe that's why you're looking at this video. A lot of people ask why TMS isn't used very often. It is covered by most insurances now. Some of the reasons are a lot of people just don't know about it. It's a fairly new procedure and hasn't been that well involved in the community yet. But there are some other reasons. TMS takes time. You have to go back for therapy sessions for several weeks. It can be expensive, especially if your insurance does not cover it. And it does have some potentially severe side effects such as seizures and cognitive changes, although these are rare. So what indicates the use of TMS in depression? So usually it's not used unless you have failed first-line treatments. And these treatments include therapy, medications, and self-help. So how exactly does TMS work? Its mechanism is not exactly clear, but it has been suggested that it is due to a change in synaptic activity related to long-term potentiation. Now that's a big neuroscience word, but basically what it means is some neural pathways in your brain are just underdeveloped. They're not used enough, and so they atrophy and they become weak. And so what the TMS does is it helps stimulate those nerves and helps them to grow, in a sense, and to become more useful and used more often. So what is the success rate for TMS? According to TMS and brainhealth.com, most TMS providers find that TMS has a success rate between 70 and 80%, which is much higher than medication, meaning that the vast majority of individuals find significant relief after treatment. About 50% of people experience complete remission, meaning the symptoms of depression are absent after just one course of treatment. So TMS can be very successful, and it should be used more often. Hopefully why you're here is to learn more about TMS because you think it's a viable treatment for you. There are so many people throughout the world who have difficulty with depression and don't have an effective treatment, or have tried a million different medications like I did, and we're only able to find minimal relief or a little bit of relief. So TMS is a very viable treatment for depression, and you should certainly look into it. Ask your doctor about it. It's not an experience that I've had personally. I've not used TMS, but it is safe and it is effective. The 70 to 80%, that's pretty amazing. Thank you so much for watching this episode with the Anxious Resistance. If you found this content helpful, please like the video, subscribe to the channel below for more information about mental health, and thank you so much for watching.